Hey, you. Ever just look in the mirror and wonder about your smile? Like why your teeth ended up the way they did?
Hmm.
Well, today on the deep dive, we're getting right into that, literally, to the root of it.
Right.
We've got some really interesting stuff here, materials from an orthodontics lecture, actually.
Yeah, foundational concepts.
Exactly. And our mission really is to pull out the key bits, how teeth and jaws develop, what can go wrong,
And why it matters.
totally, why it matters for your health, your confidence, everything. Think of this as your shortcut to understanding, how your bite happens.
That's a great way to put it. We are diving into orthodontics. It's all about that growth and development, dentition, surrounding structures.
Dentition meaning.
Your teeth, basically, the whole set.
Mm.
Orthodontics looks at how that develops alongside your jaws and face.
Huh.
And its role is really twofold: prevention and correction, fixing things like malocclusion.
Which is the technical term for a bad bite.
Yeah, essentially any deviation from the ideal bite. And of course, straightening teeth, that's what most people think of.
Okay, so malocclusion deviations, how does that even start? Is it just like bad luck? Or are there specific reasons? I mean, I always assume genetics is involved somehow.
Oh, you're absolutely right. Genetics plays a really significant part. It's kind of the blueprint.
Right.
You often see similar patterns in families, don't you? Jaw shape, tooth size relative to the jaw.
Yeah, definitely. You see families where everyone has like a similar smile or maybe similar crowding.
Exactly. So you might inherit, say, a predisposition for jaws and teeth that don't quite match up in size, or more complex things like facial clefts, palatal clefts. Those have strong genetic links.
Okay.
Even things like having a particularly large or small tongue, or how the frenum system, those little bits of tissue connecting your lips and tongue, how those develop, even the muscles. It's all part of that genetic package.
Wow. So the blueprint can have some specific instructions that lead things off track from the
You
start.
can set the stage, yes. But surely it's not all genetics, is it? I mean, our bodies, our general health must play a role, too.
Absolutely. Your overall systemic health is surprisingly influential,
Mm-hmm.
especially during development.
How so?
Well, think about it. Your teeth are forming as part of your whole body's development. So if your body experiences significant stress or disruption,
Like what?
things like serious infectious diseases during childhood or endocrine disturbances, problems with hormones, even nutritional disturbances can impact how teeth form and jaws grow.
Mm-hmm. Okay, that makes sense. Any specific examples?
Well, a really striking one is high fever. If a child has a very high fever during the specific time when tooth buds are forming,
Like really early on?
yeah, when those permanent teeth are just starting under the gums, that fever can disrupt the cells forming the enamel.
No way.
Yes, and the result can be malformed teeth, defects in the enamel itself, pits, grooves, discoloration, things like that. Wow, okay. I had no idea fever could do that. So genes set the stage. Overall health can influence the building process. What about things happening right in the mouth, like local problems?
Yes, definitely. There are quite a few local factors right there in the oral cavity that can throw things off.
Such as?
Well, a big one is the timing of losing baby teeth, deciduous teeth.
Right, I remember being told not to wiggle them too much.
Huh. Well, the issue is more if they're lost too early, perhaps due to decay or injury.
Huh.
That space isn't held, and the permanent teeth behind them or even adjacent teeth can drift into that space. That leads to crowding or blocked out permanent teeth later.
Okay, and if they stay too long?
That's also a problem. If a baby tooth is stubborn and doesn't fall out, it can block the path of the permanent tooth trying to erupt. It might force the permanent tooth to come in crooked, or sometimes it gets stuck entirely.
Huh. Timing is everything then.
It really is. Other local things include permanent tooth erupting unusually early, or losing a permanent tooth early due to decay or trauma again, messing up the spacing. And then you have things like periodontal problems, gum disease, which can affect the support of the teeth. Cysts or other growths in the jaw can physically push teeth out of alignment. And of course, injuries or direct trauma to the mouth or jaws.
Okay, yeah, that makes sense.
Yeah.
It sounds like a bit of a delicate balance in there.
Yeah.
Now, habits. We all hear about them. Thumb sucking comes to mind immediately. How much damage can that actually do?
Habits can be surprisingly powerful, especially when they're consistent over a long time. Thumb sucking is a classic example. It's very common, and actually, if a child stops the habit before, say, age 5,
Yeah.
usually there are no permanent defects. The tissues are quite adaptable at that age.
Okay, that's reassuring.
But if it continues after 5, when the permanent teeth are starting to come in and the jaws are growing more,
Then it's a problem.
then you can start to see real changes. That constant pressure from the thumb can push the upper front teeth forward and outward. It can also affect the shape of the palate, the roof of the mouth, and even narrow the upper dental arch.
Wow. Okay. So age 5 is kind of a benchmark there. What about tongue thrusting? I've heard that term. What is that?
Tongue thrusting is basically an abnormal swallowing pattern. Instead of placing the tongue tip on the roof of the mouth behind the front teeth when swallowing,
Which is normal.
which is the typical mature swallow, yes. Someone with a tongue thrust pushes their tongue forward, often pressing against the back of their upper front teeth, or sometimes between the upper and lower front teeth.
And we swallow loads of times a day, right?
Thousands. So even if it's seemingly gentle pressure, that repetition,
Adds up.
it adds up. It can push those upper teeth forward, contributing to an overjet or sometimes creating an open bite where the front teeth don't meet.
Right. Consistent pressure again.
Yeah.
Now, bruxism, teeth grinding. How does that fit in? Does it change alignment?
That's correct. Bruxism is involuntary grinding or clenching. It doesn't usually affect the initial development or eruption position of the teeth in the same way thumb sucking might. But the heavy, often sideways forces involved can cause significant wear on the biting surfaces of the teeth. It can lead to fractures, sensitivity, muscle pain, jaw joint problems, things an orthodontist might need to consider or help manage alongside treatment.
So more about damage than initial position, generally.
Generally, yes. Although severe long-term bruxism could potentially contribute to some tooth movement over time, but its primary impact is wear and tear and jaw issues.
Got it. And the last habit mentioned was mouth breathing. It seemed pretty basic, but I read it could actually change your face shape. How?
It sounds surprising, doesn't it? But chronic mouth breathing, often due to allergies or nasal obstruction, can have noticeable effects.
Yeah.
When you consistently breathe through your mouth, your posture changes slightly. Your mouth is open, and crucially, your tongue tends to rest low on the floor of the mouth, instead of resting gently against the palate, the roof of the mouth. That upward pressure from the tongue normally helps the upper jaw develop outwards, giving it a nice wide U shape. Without that internal support from the tongue, the cheeks can exert more inward pressure, and the upper arch can develop narrower, sometimes more V-shaped.
And that leads to?
Crowding of the upper teeth. It can also contribute to a longer face appearance over time. So yeah, how you breathe habitually can influence facial and dental development.
That's fascinating. I never would have connected breathing patterns to tooth alignment like that.
It's all interconnected.
Okay, so we've covered a lot of the hows and whys, genetics, health, local stuff, habits. Let's shift to the result, the bite itself. We hear terms like occlusion and malocclusion. Can you break those down? Why is the bite so important?
Right. This is really where it all comes together. Occlusion is simply the relationship between your upper and lower teeth when they meet, how they bite together.
Okay.
And it's not static, your bite can change over your lifetime due to wear, tooth loss, dental work. It's an ongoing process.
Now what's the good version? Ideal occlusion.
Ideal occlusion is, well, the ideal. It's where the biting surfaces have maximum contact, everything fits together efficiently and stably. Think of it like gears meshing perfectly.
Are there specifics?
Yes. Typically, in ideal occlusion, the upper front teeth slightly overlap the lower front teeth, vertically maybe about 2 millimeters, covering the incisal third.
Okay.
And horizontally, there's also a slight overlap. For the back teeth, the cusps, the pointy bits, should interlock in a specific way. The outer cusps of the upper teeth should sit just outside the outer cusps of the lower teeth.
Like a lid on a box, sort of.
That's a decent analogy, yeah. The upper arch is slightly larger and sits over the lower arch.
And I saw the term centric occlusion. Is that the same as ideal?
Not quite. Centric occlusion specifically refers to the position when your jaws are fully closed and your teeth are making maximum contact, whatever that contact pattern is.
Ah, so it could be an ideal bite or it could be a not-so-ideal bite, but it's just the closed position.
Exactly. It's the end point of your chewing closure. Ideal occlusion describes the quality of that contact in the centric position.
Got it. So if ideal occlusion is the goal, then malocclusion is anything else.
Pretty much. Malocclusion is any deviation from that normal, ideal pattern of occlusion.
And if your bite isn't ideal, what's the big deal? Is it just about looks?
Oh, definitely not just about looks, although that's important to people's confidence, of course. Malocclusion can have real functional consequences.
Like what?
Well, first off, impaired chewing mastication. If your teeth don't meet properly, it's harder to break down food effectively.
Okay, makes sense.
Misaligned teeth are also generally harder to clean properly. More nooks and crannies for plaque and bacteria to hide.
Which means?
Increased risk of cavities, caries, and also periodontal disease, gum disease.
Right.
Over the long run, a bad bite and the resulting gum problems can even contribute to early tooth loss. Some types of malocclusion can also be linked to abnormal respiratory habits, like encouraging mouth breathing, and potentially even contribute to speech difficulties in some cases.
So it really affects overall oral health, function, and even potentially breathing and speech. It's much more than cosmetic.
Absolutely. A stable, functional bite is really foundational for long-term oral health.
Okay. Now, the lecture material mentions some specific types of malocclusion. Can we run through those quickly? First one was overjet.
Right. Overjet is about the horizontal relationship of the front teeth. It's the horizontal distance, think front to back, that the upper front teeth stick out ahead of the lower front teeth.
So if someone's top front teeth really protrude outwards.
Exactly. You measure that horizontal gap, sometimes called buck teeth, though that's not a clinical term.
Okay, horizontal distance. Then overbite sounds similar, but vertical.
Precisely. Overbite measures the vertical overlap, how much the upper front teeth cover the lower front teeth when the back teeth are together.
And there's a normal amount.
Yes, as we said for ideal occlusion, a slight overlap is normal, covering maybe the incisal third of the lower teeth. An excessive overbite, or deep bite, is when they cover much more, sometimes even hitting the lower gums.
Got it. Jet is horizontal, bite is vertical. What about an open bite?
An open bite is exactly what it sounds like. When the back teeth are closed, there's a vertical gap or opening between the upper and lower front teeth. They don't overlap at all. They don't even touch.
So you can literally see through the space.
Often, yes. Usually in the front, but it can occur in the back too, though that's less common. Often related to habits like thumb sucking or tongue thrusting.
Okay. And the last one was crossbite. This one always seemed a bit tricky to me.
It can be. Think back to that lid on the box idea, where the upper teeth should be slightly outside the lower teeth.
Right.
A crossbite is when that relationship is reversed for one or more teeth. So an upper tooth or several upper teeth might bite down inside the lower teeth instead of outside.
Ah, okay. So the upper teeth are tucked inwards.
Exactly. It can happen with front teeth, where an upper incisor is behind a lower incisor, or with back teeth, where the outer cusps of the upper molars bite inside the outer cusps of the lower molars. It can be just one tooth or a whole segment.
Okay, that zipper analogy makes sense now. Part of the zipper is just misaligned inside out.
That's a good way to think about it.
Wow. So we've really journeyed from the very beginnings, the genetic code, through health factors, local mouth issues, habits, all the way to how the final bite comes together and the different ways it can deviate. It's kind of amazing how much has to go right.
It truly is. It's a complex interplay. Genetics lays the foundation, but then systemic health, local factors, function, habits, they all sculpt the final result. It's quite dynamic.
It really gives you a new appreciation for, well, for your mouth. And understanding this, it's not just for dentists, is it? It helps you understand your own health better.
Absolutely. Being aware of these potential influences helps you understand why things might be the way they are, and maybe be more proactive about oral health for yourself or your kids.
Definitely. So as you're processing all this, maybe take a second to think about your own experience or people you know. Can you see any of these factors potentially at play? Genetics in the family, any childhood illnesses, or maybe a lingering habit? Did baby teeth fall out strangely? Wait, certainly something to chew on.
Indeed.
Thanks for diving deep into the world of orthodontics with us today. Really fascinating stuff.